Uh, Good afternoon, and I'm the last batsman of this conference, and I'd like to thank the conference organizers, especially Dr. Bhushan, for giving me this task to learn and also present. Rural nephrology and role of digital literacy. Because actually a straight topic will be easy, like a membranous nephropathy update, and all those things will be easy. But the rural nephrology and role of digital literacy was a topic given to be me. I think it is to teach me that how to do rural nephrology and digital literacy. I take it as a challenge. I'll try to justify within this short span of time that is given to me. So everybody knows that actually the kidney disease prevalence is increasing, and it's going to increase in near future also. By 2040, it is going to be the leading cause of, fifth cause of the YLL, means year loss of lives in a lot of NCDs. And burden is also increasing in our state, where if you kindly observe, every year on year, the expenditure on kidney health is increasing. And what is the role of this rural nephrology? I just try to take up where the kidney disease is appearing every year. So we have roughly around 3,000 new cases of ESRD being added to hemodialysis every year. In that, actually, if you look at it, actually the average kidney cases per lakh population is 26. And if you see in the left side of the graph table, where you can see that a lot of districts are having higher than the state average, the incidence of ESRD in those districts. So the kidney disease is spread across the state. And the patients also migrating to other districts to get the dialysis and other kidney care access. So in the state of Telangana, burden is high and is also increasing, and distribution of the patients spread across the state, and patient migration for the treatment to Hyderabad and bigger cities, and we have roughly 3,000 new kidney disease patients requiring dialysis per year, and our production of nephrologists is only 30 nephrologists, less than 30 nephrologists per annum. And what is the goal? We know that the problem is there, like kidney disease is there, rural areas also kidney disease is more, and the production of nephrologists is less. And what is the goal of the nephrology society across the globe? This year, the emphasis of World Kidney Day is equitable access. So what is equity that I'm going to tell? So major goal is universal kidney care is a major goal as a part of universal health coverage. In that, 100% patients we need to cover, and 100% of services we have to give, and 100% of the cost we need to cover for the patient care of the kidney diseases. So in this, actually the 100% population is covered with 90% Arogyasri and 10% with other governmental schemes like Employee Health Scheme, RTC, Singer, and other areas. The population is being covered. Services also, majority of the services are covered, like promotive, preventive, curative, rehabilitative, and also palliative. And cost also, majority of the costs are covered. What are the strategies which are adopted for equitable healthcare? The strategies is actually decentralization of the healthcare as a district as a unit, like the increase in the tier system. Yesterday also I explained regarding 3-tier to 5-tier system by adding Palle Davakhana and Basi Davakhana at the lower base level, and also having quaternary care at the top level, in addition to the existing primary, secondary, and tertiary healthcare. And what is the role of digital literacy for the health staff and patients to bridge this gap? Because we need to deliver the service for the population, services, and also for the cost. So what is the difference between this equity? We need to clearly understand what is the equality and equity difference. Equality means if you see the service is available, but how many percentage of the people are accessing the service is the important thing. If at all we are not making all the people to access the services, providing the services is of no use. So we need to have rural urban divide or remote, and in the urban also in the other areas, affluent society to non-affluent society, everywhere the equity should be maintained well. We need to go an extra mile using a digital literacy so that actually people are uplifted to take the services which are being given by the government. Then I'll try to understand what is digital health literacy. So digital health literacy applicable to the both healthcare provider and also the patient. So we need to educate ourselves on digital health, and also we need to educate service providers are there, like technicians we need to educate, nurses we need to educate, and also the patient also need to be educated on understanding the digital health literacy. And digital health literacy and equitable healthcare, the population coverage also we can increase by providing the healthcare to the remote and tribal areas. Service also we can increase by providing tele-consultations, tele-follow-up, and tele-diagnostics. And cost also, transportation cost can be reduced, waiting time for the consultation also can be reduced, and hospitalization costs also can be reduced. So this journey of providing the equitable care, I think Professor Dakshinamurthy sir is sitting here, he knows that actually we had a telemedicine vehicle in 2009 that I'm talking, where I just joined as assistant professor at that time. Actually we got a donation from the Singareni Collieries, where actually we equipped this vehicle with a antenna. You see at that time this 3G, 4G was not there. The telemedicine, the vehicle was provided. In that vehicle actually we fitted the auto analyzer, you're able to see the X-ray in the back end, and auto analyzer is there, ultrasound is there. So everything was fitted, and with equipment we used to move around the villages to do the screening. And this sort of a screening also consultation was done in way back in 2009 from NIMS to the other peripheral centers of the state, combined state. We had also publication which was there, Accountable Healthcare Role of Telemedicine in a Developing Country was there in 2009. And the same access was given from Singareni Collieries to have fixed day clinics. The concept was started at that time where actually all Singareni Collieries were having an MOU with us, where from sitting at NIMS, this is our ex-director and dean who were monitoring that program from Singareni Collieries CMD at that time, Sutirtha Bhattacharya Garu. So where all the centers of Singareni was connected with NIMS, where we used to provide telehealth services. Now also this program is running. So after that, what happened, actually digital literacy further improved, and Telangana now is a part of E-Sanjeevani program started by the Government of India, where the district hospitals, area hospitals and community health centers are working as hubs. And you see the spokes on the right side. So you see the Basidavakana, sub-centers, PHCs and UPSCs, and e-prescriptions are sent. And you see that actually the primary health center, total 4,935 facilities are connected with these under E-Sanjeevani program. And we had consultation of 1,35,000 consultations was done. And these are consultations happening from hub to the spokes. And to tell you that actually our department nephrology took a lot of initiative, and in the super specialty, nephrology is the #1 in providing super specialty telehealth services in the state. And for this actually I had an opportunity to get a prize to receive the prize on behalf of the government of Telangana. I went to Varanasi and received the prize from the Honorable Health Minister of the India, Mansukh Mandavia Garu, on the World the Universal Health Coverage Day in Varanasi for 22-23. All the other states also doing, but our state, Telangana state, got third prize for the year 22-23. And apart from this providing consultations, so we also expanded this sort of a digital health literacy to the providing diagnostics also, because we need to empower the both healthcare provider and also the patients. So digital health literacy in Telangana diagnostics also, all the diagnostics wherever the patient is, we can collect the sample and the direct reports are sent to the patient mobile directly. Healthcare provider directly. If at all a patient comes to a sub-center, a rural area, he can give a blood sample within 24 hours. The turnover time is around 24 hours. He'll get the reports on his mobile. Doctor gets information, nurse will get information, also patient also get information. Similar project initially was done in NIMS, but later expanded to all the entire state this expanded. And the lab is also, they tell you happily that this lab, Telangana Diagnostic Lab, is also enabled, accredited. App is developed based on digital reports are given. Telepathology also is underway, where a kidney biopsy can be done in the peripheral center. We can scan the slide, can be sent for the expert consultation. That is under process. And regarding dialysis, I'd like to tell you actually the state has 103 dialysis centers in a hub and spoke model, and 10,000 patients are there, and more than 10 lakh sessions is being done. So yesterday a lot of seniors given comments that we need to improve the quality. Apart from improving the access, the quality is also important. For that actually the digital literacy again being used from Nizam Institute of Medical Sciences to connect to all these centers. So we did not have a big app, but we have used the Zoom connectivity with all the centers. All the peripheral centers are connected 24/7 with the Zoom connectivity. You can see there actually the Zoom connection is on, and a chat box is also there. All the centers live patient, like at a time 1,000 patients are getting dialysis across the state, and all the centers are being connected with the Zoom link. Any patient having any problem, they can post in the group. They can have a group in the chat box. We can answer from NIMS. So directly one coordinator is there where he'll bring out like any access problem is there, any fever is there, any accelerated hypertension is there. Automatically that is being addressed from Nizam Institute of Medical Sciences to all these centers. This is a pilot project that we have done. You see here, the doctor is being educated in telehealth, digital literacy. Patient care provider is also being educated. Like you see the technician is holding a mobile phone. along with the patient so that the consultation can be facilitated, and patient himself got educated in digital literacy. That is known as digital literacy to the healthcare provider, both doctor and technical staff and also patient. So everybody being educated on using how to use this digital literacy. And apart from that, actually next program is Dr. Karthik yesterday presented on NephroFlow. Apart from taking the data from the Zoom, directly connecting the machine to the monitoring machine. So we can connect directly the machine. We can also monitor the how many hours this machine ran, because we need to ensure we are paying for 4 hours, whether the machine has run for 4 hours or not. In that 4 hours, what happened? How much blood volume is being treated to have an adequacy? Like 60 liters of blood volume has to be purified to get an adequacy of 1.2 kT over V. Whether that is done or not, no need to monitor physically. The machine automatically gives the report. So based on this, if at all we are able to monitor this program, then only the payment will be made to the service provider. This is how the quality is being ensured. This is an equitable access. If at all patient is getting a dialysis in Nizam Institute of Medical Sciences in Hyderabad, same way, same quality of dialysis should be provided in Utnur of Adilabad, A2 Nagaram of Warangal, where a tribal area is there, Bhadrachalam. All these areas also same equitable dialysis should be provided. That is being done with this sort of a digital the literacy. So ultimately the digital health literacy for healthcare equity and empowerment is important area where we can consider it, and it can be implementable in affordable and a scalable fashion. So what the Martin Luther King told, of all forms of inequality, injustice in healthcare is the most shocking and inhumane. I think we need to address this. That's how the 2024, the World Kidney Organization has taken the logo of equitable kidney care across the globe. I think in digital literacy, I think it will play a very big role in providing the access to the needy people in an affordable fashion. So I thank the organizer for giving this opportunity for presenting the digital literacy in rural healthcare delivery. Thank you very much. I think I finished.